Right. And so the part of the problem is we don't do any kind of routine lung function testing. Think about how many times you've had your blood pressure measured. Have you ever had your lung function measured, Chris?
I don't think so. I don't think so. And a lot of that I kind of blame on medicine being very reactionary at the same time, just as a whole.
So there were a couple of studies that came out during the pandemic that for me were incredibly enlightening, and I have to admit have really changed how I think about this. So there was a study that was done in Oregon, and they looked at the impact of the wildfire season that we had in the middle of the pandemic. And they found that in the area that was exposed to the wildfires, there were roughly in excess 20,000 cases of COVID and 750 deaths. And what that suggests to me is I bet you almost none of those people realized that exposure resulted in lung injury that may not have actually hit their radar, right? We don't even have a name for that kind of disease, right? It's just there's some micro lung injury, lung inflammation that happened that then increased their vulnerability for contracting and suffering severe illness from a respiratory virus that happened to be going around at the same time.